Hello, my name is Annalie Martin, and today I am going to be going over a few skills with you. That includes spiking and priming the bag, the IV bag, and also the gravity rate and the HEP saline lock and flush. This is actually more tangled than I remembered. I had done this last year, so I had to pull this back out. Okay, so the whole point of priming the bag is you're gonna want to prevent the air embolism. So of course you're gonna want to do hand hygiene, confirm your solution. You're always gonna want to label. The helpful video I was watching as a refresher said it's nice to label right below, like right in about this spot, because then it's easily visible to anybody. So you're going to want to know when you did it, when it's going to need to be changed, and you're going to want to change that according to the company policy. It says the tubing is usually changed every 96 hours according to the CDC. Some hospitals like to do that sooner. So first I am going to put the clamp on, just while I'm spiking it. And I am going to, this is mine from last year, so it's like a little bit used, but I am going to use this port, and normally I would probably want to wear gloves, but just because I am doing it at home, I'm gonna trust that I'll be okay, not to get anything on my hands. So I'm just gonna want to put this in with a twisting motion, make sure that's really in there, and then I am going to, and I want to make sure not to touch either because you don't want to contaminate anything. So then I'm going to flip it over. You're going to want to, there's a little line here that's about 2/3. I'm learning from last year that you want to do it slow because it fills pretty quickly. Last year I accidentally filled it a little too high, so not last year, I guess it is technically last year. So I filled it right to that line, like you're supposed to. And then what I'm going to do is I'm going to release the clamp to allow the water to run through the tube. And you're going to have to kind of let that go down so that the water flows through. Let's see. My clamp is off. Oops. So. All right, now the water is all the way through, so I'm checking for any kinks, and just making sure that, which is kind of hard to do here, I'm trying my best, but like if there's any air, you might have to kind of like flick it, and just make sure that those bubbles are completely out of there. And the port is also very important. You're going to want to make sure that you keep this where you don't, get any contamination, and that before you put the cap back on, you clean the port. So this, I think, looks good. So I am going to hang this up on my homemade place to hang it. So after that, I'm gonna clamp it back up, and what I'm gonna do is I'm going to I want to regulate the gravity rate. Normally you would be hooking this up to a pump. That's like the preferred way, but if you don't, then like say, oh, here it comes. Say that I clamped it up. Nope, I didn't. You're gonna want to do this, say you want 21 drops per minute. So for example, like with my watch here, I could use the clamp to slow the amount, but I want to get it to where this is coming out at that scheduled time. So you could do it in maybe like increments of like 15 seconds, but you're going to want to watch it for that full minute and get it to where 21 drops are coming out of the chamber, if that makes sense. So if it's coming, say, a little fast, then you're going to just kind of slow, like right now it's really fast, so I'm slowing it down. There we go now. So now I would count for that full minute. So 3, 4, 5, 6, 7, 8, 9, 10, 12, 13, 14, 15, 16, 17, 18, 19, 20, 21. Okay, so that's a little fast, so then I would just slow it down. There we go. I'm watching the time on my Alexa. So okay, so yeah, basically you're just gonna keep you know, right, like just you're gonna want to make sure that you time that, because that is very important, and you're not gonna want to do that while it's hooked up to the patient. So, you know, obviously you wouldn't want to, if it goes too fast, you wouldn't want it going into the patient too fast. So you're going to want to make sure that you regulate that before you give that to the patient. And another thing that I don't think I said in the beginning was that you also want to make sure that you obviously check the solution before you give it to the patient. You don't want to give them something that they are not supposed to have. Make sure that you do have the right, you know, the right solution to give to the patient. So we covered the spike and priming the bag and the gravity rate of the drip chamber. So let me just clamp this up. And I should also add that the port on the bottom is what is going to hook into the patient's HEP and saline lock, which is where I'm going next with this. So of course you're going to want to ID the patient. So if they have they will have a dressing if they have a HEP lock. So you're just going to want to see, are the edges lifted? When is it dated within the policy? You're also going to want to check the size of the catheter, make sure that that is the correct size for the patient. You're going to want to look for that phlebitis, erythema, infiltration, any pain, ask them if they have any pain. Is the NutriConnector applied? If it's not running, the clamp should obviously be on. And then when you clean it, you're going to take your alcohol swab and you're going to clean that port. And then you are going to want to do that for at least, and I did forget to add in the beginning, of course you're going to want to do your hand hygiene. I always like to include that because it's so important. So then you're going to scrub the port for 15 seconds. You're going to make sure to let that air dry. And then you're just going to attach this syringe. And then you will open up the clamp and you will attach this syringe right into the site. And you're going to want to, using like a pulsating pressure, and you're going to want to instill, usually most of my reading told me that you're going to do about 3 ml. So you're going to just squeeze that 3 ml in, and then you're going to want to, then you'll be able to clamp it, and that's it. All right.